Good morning, Mr. Nana.
Good morning, Dr. Kular.
Welcome to Kular Hospital.
Thank you.
So, just tell me briefly how you decided to come from South Africa to Kular Hospital for mini gastric bypass.
So basically, I've done a number of research. So I had looked at the US. Then I realized the prices were also very high. But I also realized they didn't have enough information. I think one of the reasons that made me to come to India was the amount of information that you guys have online.
Okay.
So it was easy for me to see a number of patients that have gone through the procedure,
Right.
and also to see patients 5 or 10 years after they have gone through the procedure.
Okay.
Yeah.
So you checked the long-term
Correct.
patients, long-term complications.
Correct.
Right.
Correct.
Okay, that's very good. So let's discuss briefly about the procedure. You know the name of the procedure?
Yes.
It is mini gastric bypass.
Yes.
You understand?
Yes.
There are other options also, like the old standard Roux-en-Y gastric bypass.
Yes.
And then we have sleeve gastrectomy.
Yes.
And this is mini gastric bypass.
Yes.
And there are, more than 100 different sets of combinations of, laparoscopic designs which we can do inside
Yes.
to make you thin.
Okay.
Actually, if we try to understand what is the concept behind weight loss surgery, basically your inside has a stomach,
Yeah.
which is like a balloon. You can say it's like a bag
Yeah.
which we eat into.
Yeah.
Okay. And then we have long intestine.
Yeah.
It's about 25 to 28 feet long.
Okay.
And some people have very long intestine.
Yeah.
Maybe 35 feet.
Oh, okay.
I've done a lot of research on this subject.
Yes.
And this design which we are carrying inside, this is old. It is changing,
Yeah.
but not changing as fast as we are changing.
Oh.
But we were supposed to be out in the sun
Correct.
without clothes,
Correct.
working for 10 hours, 12
Yeah.
hours a day. So we never knew whether we get food next day or not. That is the reason why our body is absorbing too much.
Okay.
So we understand that there are a lot of reasons like wrong eating, binge eating,
Yes.
junk foods, sweet tooth, and there's a lot of genetics also.
Yeah.
But what I feel is like a smart person,
Yes.
you are handling your life, your business, your family.
Yeah.
But why it becomes difficult to manage your body? That means there is something hidden
Correct.
underneath,
Correct.
which doesn't let you do this,
Correct.
and you become diseased because of obesity.
Yes.
That is when we label you as morbidly obese.
Oh, okay.
Like in your case, you are snoring,
Yes.
you have diabetes,
Yeah.
and we checked today when you came early morning, it was about 400, and now it is 288.
Correct.
So then we checked your triglycerides, cholesterol.
Yeah.
It's like 10 times more than what it should
Yeah.
have been. So what is happening? Because your body is absorbing too much.
Yeah.
So what can we do inside? We can decrease the size of the stomach. That's
Yeah.
number one.
Yeah.
And in addition to that, we can bypass a part of the intestine
Yeah.
so that you absorb less.
Yes.
So this is an effort to change the internal design,
Yeah.
which should fit our present day
Okay.
life,
Yeah.
our present day work,
Yeah.
so that we can enjoy, we can relish our food, because this brain is kind of programmed.
Yeah.
It is tuned.
Yeah.
It wants calories, it wants carbs. That is how it gets satisfied.
Yeah.
There are lot many hormones like dopamine, serotonin, which are happiness hormones,
Yeah.
behind this story. So see, when you have food, you get happiness.
Yes.
That is the reason why we take it.
Oh.
And see, we just don't eat to fill the tummies.
Oh, yeah.
And in my last 15 years of bariatric surgery practice, I have got to know this looking at bariatric surgery from patient's point of view.
Yeah.
We need to see it from patient's perspective.
Yeah.
As a doctor, I will think, okay, yes, you want to lose weight, okay, I'll give you a procedure which makes you lose weight.
Yes.
It can be a band, sleeve, Roux-en-Y,
Yeah.
MGB,
Yeah.
whatever.
Yeah.
But I need to understand what is the background of my patient, what
Correct.
kind of eating you're doing,
Yes.
so that I give you a design which should be comfortable for
Yes.
you.
Yes.
we talk about changing the lifestyle, but we know nobody can change the lifestyle permanently.
Right.
If you can change the lifestyle, just keep a diet chart.
Yes.
1,000 calories in front of
Yes.
you, and you're done. You don't need to come to India from
Correct.
South Africa
Correct.
for this. So my viewpoint is that bariatric surgery has to be customized.
Yes.
And we are doing this customization since last 15 years.
Okay.
Before that, I was with Dr. Rutledge in the
Yes.
US. You must have checked.
I've seen him.
So yeah, actually Rutledge had, he brought this mini gastric bypass into this world for the first time, and he had done a lot of work, and I got a chance to work with him, and now we have done surgeries in more than 10 countries throughout the world together.
Yeah.
So every year he would be here with me for like 2 months at least. So we work together. This is going on from last 15 years.
Oh, okay.
So in India, we are blessed to do the customization on our own. Because you are coming, you are paying from the pocket.
Correct.
If I tell you, Nana, you have to pay $1,000 extra.
Yeah.
But I'll give you a design which will make you feel good. Almost negligible nausea, negligible vomiting.
Yeah.
You can enjoy your food at the same time. You can lose a good amount of weight.
Yeah.
And the procedure is reversible. Procedure takes 20 minutes.
Yeah.
It's the safest one. So obviously, there are options, especially when it comes to elective medical surgeries.
Yeah. Oh, yeah.
Here, you can select sleeve, band, bypass, whatever you want.
Yeah.
And as a doctor, as a surgeon, it's my duty to, to make my patients happy.
Yes.
If you are happy, I'm happy.
Okay.
So the concept is decreasing the size of the stomach, bypassing some part of the intestine.
Yeah.
In some cases, we will do a longer bypass and shorter bypass.
Yeah.
If you want to lose less weight, we do a smaller bypass.
Yeah.
So if some patient is taking a lot of oils, a lot of fats, we are doing longer bypass.
Yeah.
So that we want to push that oil and fat. You can literally see that oil getting out in the stools.
Yeah.
That's actually that's what exactly we want.
Oh.
So as far as the restrictive procedures are concerned, like band and sleeve, I have seen there are main two differences. With restriction, when I make something tight,
Yes.
and if the outlet is also tight,
Yes.
so the food is coming in
Yeah.
but cannot get out. So the pressure will go high.
Oh,
So
I see.
this is something, we are looking into long term,
Yes.
The problem with restrictive surgeries was that because of the high pressure, the dilatation is more than what we see in the mini gastric bypass. In mini gastric bypass, we decrease the size of the stomach,
Yes.
but the outlet is wide.
Oh.
Because on the other hand, you have the bypass also. Because
Correct.
there are two, legs of mini
Yes,
gastric bypass.
yes.
One is decrease the size of the stomach,
Yeah.
but then the food is being delivered 6 feet further.
Oh.
So you have less intestine to
Yes.
absorb. So,
Yes.
so patient can start eating quickly after surgery. Like on day 1, we can start you with liquids. Next
Yeah.
day, semi-solids or thick soups, etc.
Yeah.
Like we have here, dal, curd, something of that sort,
Yes.
or mashed things.
Yeah.
So within 7 days, you're pretty much back to the normal diet.
Oh, I see.
So because the outlet is wider,
Yeah.
but absorption is limited.
Yeah.
And that is in our control, how much to bypass.
Correct.
So we want to make you lose. There's a lot of research.
Yeah.
So basically this is as simple as anything, matter
Yes.
of common sense.
Yeah.
We need to deposit less.
Yes.
Not only that, we need to eat less.
Yes.
Because eating too little will make you depressed.
Correct. I agree.
So this is the second point from patient's side,
Yes.
that we want to eat at least like a normal human being.
Correct.
So that
Correct.
we can live a normal life.
Correct.
So my duty is to give you a good designing
Yeah.
and to give you a world-class designing which
Yeah.
should let you eat like a normal person,
Okay.
and nausea, vomiting should be minimal.
Yeah.
And this happens in 99.9% of our patients.
Oh,
They
okay.
are happy with the designing.
Yes.
Yeah.
Okay.
And then in the long run, keep on taking healthy diet, vitamins, test every 6 months. Anything else you want to ask me?
So how quickly do you go back to, if you want to go back to full exercise
Okay.
after
yeah.
the
Full exercises would mean going to the gym, lifting all weights, doing strong abdominal crunches and all the exercises. That should happen after 6 weeks of surgery.
Oh, after
We're
6
doing
weeks.
it today.
Yes.
After 6 weeks from today, means 1.5 months.
Correct.
But about walk, long walk,
Yes.
brisk walk,
Yes.
that should start from today evening.
Oh,
Okay.
okay.
So I'll try to give you everything best, try to give you the best of it, what you can have in the world.
Thank you, doctor.
That's my promise.
Yeah,
okay?
thank you, doctor.
Any other questions?
No, I'm good.
Okay.
Yeah.
Thank you very much.
Thank you very much.
See you in the
Thank
operation
you.
theater.
Okay.